Greetings, this is Pink Frog Yellow Boots from Behavior, working towards achieving holistic health for everybody. The term panic attack and anxiety attack are used interchangeably. However, they are two different things. When we speak of anxiety, we are speaking of a sense of worry that gradually builds up and intensifies and has a specific trigger, like a thought or a notion that something might happen that could be out of control that needs to be worried about. Anxiety is a normal human tendency that keeps us alert during a situation that needs a fight, flight, and freeze response. It is a response to external stimuli which helps us to prepare ourselves to deal with it in the best possible manner. However, a lot of time anxiety may cause a lot of worry and sense of being unable to deal with all that may result in an anxiety attack. When we speak of panic attack, we are speaking of something that occurs abruptly without any specific triggers or stimuli. They just happen and subside within few minutes to half an hour. When we speak of anxiety, they might continue for a prolonged period of time, gradually build and then subside. It could be for a day, a month, or can gradually keep coming as external stimuli keep happening. To understand it better, consider anxiety as a normal functioning for humans, but which becomes bothersome when it keeps impacting and affecting a normal function. That is, a normal worry to complete things is good for you, but when that worry makes you not able to function, it becomes a worry. It becomes a concern in the mental health area. However, a lot of worry, which leads to anxiety, that leads to fear, may turn into a panic attack, which means that when a panic attack happens, it could be led by anxiety. As mentioned, mostly panic attacks are abrupt, out of the blues. They come, they peak, and they go in a span of few minutes. To keep a check, the symptoms of anxiety include being startled, having a rapid heart rate, worry and distress, restlessness, sleep disturbances, shortness of breath, lack of concentration, muscle pain, irritability, loss of concentration, fatigue, dryness of mouth, chest pain can be considered as basic symptoms. When we speak of panic attack, the symptoms to look forward to are, starting with the major difference from anxiety attack. In panic attack, people feel detached from reality and or self, that is depersonalization and derealization, feeling of losing control, feeling like you are growing crazy, your brain goes completely numb, you have a sudden fear that you might die. Other similar to anxiety symptoms are pounding heartbeat, dizziness or lightheadedness, nausea, shivering or shaking, shortness of breath, stomach pain, sweating, feeling like you are being choked or smothered, numbness or tingling in the extremities, hot flashes and chest pain, to be mentioned as few to look forward to or look out for. When we look for anxiety attacks and panic attacks, it can be seen that anxiety attacks are more common and are gradual and stay longer, while panic attacks are shorter, abrupt, and happen in few minutes. So one can be expecting an anxiety attack which is after a build-up of lot of anxiety, while panic attacks are something that just happen out of the blues. Things that might be a situation that might lead to anxiety or panic could be work stress, social stress, addictions of drugs, alcohol, or caffeine, driving. It could also be due to withdrawal symptoms of any addiction, chronic conditions or illnesses, prolonged illnesses, side effects of medication or supplements, various phobias or memory of trauma from childhood, or a sudden traumatic event that happened and left a impactful mark of itself. People in general with anxious personality, having another mental health issue, a family member with anxiety or panic disorder, issue with drugs or substance abuse, ongoing long-term stress or in personal or professional life, a sudden traumatic event, experience of trauma may have a higher risk of having panic attack. When suffering, when to know that it is time to consult a psychiatrist and a psychologist. It is common to have basic anxiety, but when it starts bothering you, it starts impacting your day-to-day functioning and life, or the severity and frequency increases from 1 or 2 in 2-3 months to on a regular basis, it is important that you visit a psychiatrist or a psychologist and get yourself diagnosed, because anxiety attack or panic attack both are manageable with professional help. Things that can be done during a panic attack or anxiety attack are making sure that you ground yourself, which would need acknowledging what is happening to you, that is, acceptance and awareness towards the symptoms. Breathing slowly and deeply will help you ground yourself. Try relaxation techniques like imagining peaceful scenario, listening to music, relaxing your body and muscles, stretching your body, practicing mindfulness, that is indulging your senses into your surrounding and being in present. Home remedies that could be tried when you know that you have a regular influence of anxiety or panic is maintaining a positive attitude, keeping yourself away from caffeine, alcohols, and drugs, eating healthy and having a healthy lifestyle, having enough sleep that it helps the body and mind rest, exercising regularly, practicing meditation, having a journal, sorting out stressful situations will help to build a stronger defense to cope with anxiety and panic attack. Anxiety and panic attacks are something that happen to a lot of people but are also manageable with professional help. Like anxiety that grows gradually, panic which comes abruptly, but it can also be an expected event with time. Both are helpful and can be dealt to leave you away from misery that it causes. Seek help. Have a safe week ahead.